Hey guys, how are you? This is Dr. Kim here. Today we're going to be looking at Sialolith. It's not something that we see every day, so I think this will be a really good learning case for you all. So what we have here is a cone beam CT scan of the patient, and this case was referred from outside clinic. And I will scroll this axial volume to the lower jaw. So right here, hopefully you noticed the calcification already. So area of interest is right here, and it is located lingual to, let's see, so I'm going to bring my crosshair right this way. And I've already looked at the scan, but this is directly lingual to the area of missing tooth number 17. Maybe we can, let's see, take a look at it as well. Let's see, does the calcification show up? Well, it doesn't show up very nicely, but it's located approximately here in the 3D rendering, and that's just lingual to area of missing number 17. Anyway, so I've already told you what this is, but let's take a closer look at this calcification. What I'll do is I'm going to rotate the volume so that we can look at this through the entire length of the calcification. So let me zoom in. So I've went ahead and oriented the scan so that we can look at the full, we can have the full visualization of the calcification, and let's measure that. It's measuring approximately 7 to 8 millimeter in this corrected sagittal plane, and in the axial, again, maybe like 7 millimeter. Let's see. So yeah, so it's measuring approximately 7 to 8 millimeter in length. And if we pay close attention, overall, how would you describe this appearance? You can use the word linear opacification or opacity, or you could say that it appears somewhat tubular or channel-like. And I like the term because that shape, or the word that we use to describe its shape, is very indicative of what this opacity would be, right? So there are different ways that different calcifications in the head and neck can appear. Most common ones are tonsilolith, but also lymph node calcification and something like sialolith. They do appear as well, and the location is obviously different, but also their appearance can be different as well. This sialolith, based on its anatomic location, we know it's in the Wharton's duct, right? Submandibular gland duct, and because this calcification occurs within the duct, it's going to have potentially shape of a duct, right? So that's very, very telling. Keep in mind that some sialolith may not necessarily look like this either. It can be completely perhaps spherical, so that you can see onion ring layers within the sialolith as it continues to calcify over a long period of time. One piece of clinical information that I have on this is the patient has had a scan done about 6 years ago, and the referring dentist noted that there was this calcification or opacification even 6 years ago, but not as dense as it is now. So this is sialolith, and I'm glad that I was able to share this case with you. Let's see. So let's look at this coronal view, and as I scroll in the AP direction, you can see the calcification is more prominent along the periphery and less so toward the center of the sialolith. So That's kind of all I wanted to share with you, but just incidentally, I've also noticed that in this particular, on this sagittal view, you will see that there is a radiolucency at the apex of endodontically treated tooth. So I don't know if the referring dentist is currently aware of that lesion, but this is something that I've also recommended to check. You know, depending on when that root canal was done, this could be resolving or persistent inflammation. And if this is persistent, then I would think the patient should have some symptoms upon percussing this tooth. And that is tooth number 25. Anyway, I hope you found this video interesting, and hope you continue to watch my video. I know that I don't require all of you to necessarily watch all of my videos, but again, I think it's really to your benefit that I get to that you learn from these cases. I mean, these are real-world cases that people are referring to me for my expertise, and they're basically paying me to tell them what it is, and you're able to learn from these cases for free by having, me posting this to YouTube. So hope you take advantage of these cases, and I'll see you next time. Take care.